Hello, my name is Janice Goodman, and I am an AEMT, and today I will be demonstrating how to do a nebulizer treatment. I have been an EMT for about 20 years, so this has been my passion and my career for the past 20 years. So as we get started, I'm going to show you how to do a nebulizer treatment. The supplies that you're going to need are some gloves, hand sanitizer, nebulizer, tubing, oxygen tank, stethoscope, and of course your nebulizer medicine, which is your albuterol. First, let's talk about the medication. Albuterol is packaged in 2.5 milligrams, and they come in these little pre-packaged tubes, and you just squeeze the top of it off to insert it into your canister when we get to that part. Let's talk about the medicine a little bit. What the medicine is used for is allergic reaction for patients that have asthma, anaphylaxis, respiratory distress, or pediatric allergic reaction. But you always want to make sure that you look at your local protocols to see if you need to use this medication. So the first thing we're going to do is identify the patient. This is going to be Mr. Smith. We need to know if we have an adult patient or a pediatric patient, because the dosage that you're going to give the patient is going to be different for the adult and the pediatric. For the adult, you're going to give 2.5 to 5 milligrams in nebulizer treatment, and you can do this 3 times, and then you need to contact medical control or check your local protocols. For pediatric patients, you would check your Braslo tape, or you're going to give 2.5 milligrams, check your Braslo tape in order to know how much of this medication you're going to administer to your child. And you want to give 3 doses as well as with the adult, but contact medical control after those 3 doses are done. So you want to ask your patient, do you have any allergies to the medication? Do you have any allergies, Mr. Smith, to albuterol? Take a set of vital signs and make sure you get the respiration rate. And before administering the medicine, you want to use your stethoscope, and you're going to listen to your lung sounds. Up here and down here, you're going to listen all 4 quadrants to your lung sounds to see if you hear any lung sounds, and you're going to document that. If the patient is wheezing, that would be one reason why we would give an albuterol treatment. Look at your medication. So we're listening to Mr. Smith. We're going to listen to his lung sounds. And I do hear some wheezing. So I'm going to administer an albuterol treatment to Mr. Smith. Got the albuterol. We want to look at it and make sure that we have the right medication. This is albuterol. And we want to make sure that we have an expiration date on here. And the expiration date on this albuterol treatment is going to be 8/2026. So the medication is good. All right. As we open our tubing, we have a mouthpiece. We have the tubing that we're going to connect. So your canister comes and looks something like this. And what you do is you screw off the top of this to put your treatment inside here. And then you connect this like so to the bottom. And then this is your T. You put your T on. And you connect that like so. And that's what it's going to look like when you give it to the patient. And this is the mouthpiece. So, as we put the medicine in here, you have the right medicine. We're going to put it into the canister. You just kind of squeeze. Get all the medicine out. And screw it back on here. And you can wait and put this part on after you put the medication in. You can go ahead and get your tea and put these two pieces on and put your medicine in here and put it like this, or you can screw it off with the mouthpiece on it. Either one works fine. So then we take this and we're going to put it onto the oxygen tank like this. Screw it up there and make sure it's good. And turn your oxygen on. We're going to do about 10 liters. You want to make sure that you get a fine mist, and then you give it to the patient and tell them to inhale and exhale. Inhale and exhale. Mr. Jones, I need you to put this in your mouth, and I want you to inhale and exhale to get the medication. This is going to be a butyrol treatment for your wheezing. And then you have a time lapse. It's going to take about 15 minutes. And the patient may do some coughing while they're taking this treatment, but it's opening up their airway so that they can breathe better. In about 15 minutes, it's going to stop. Your fine mist is going to stop. You want to just tap your container, just lightly tap it and make sure that all your medication is coming through. And you tap your container and just keep giving it to them until you have no fine mist at all. When you're done, you want to turn your oxygen tank off. Take this away from the patient. And these can be used over for the same patient. Not different patients, but it can be used over for the same patient. So you can leave this with the patient, or if you're in pre-hospital care, you can take it in the hospital with it. After the fine mist is over, after about 15 minutes, and you tap your container to make sure that all your mist is gone, you want to reassess your lung size. 1, 2, 3, 4. Mr. Jones, that albuterol treatment did you very well. Your wheezing, I don't hear as much wheezing as I did when we started the treatment. You document your findings after you do your reassessment, and that's your albuterol treatment.